My name is Brent Overton. I'm one of the spine surgeons here at the Steindler Orthopedic Clinic, and today I'm going to be talking to you about lumbar laminectomy. Lumbar laminectomy is a treatment for spinal stenosis. Spinal stenosis is a condition where the nerves in the back are pinched because of thickening of bones and ligament or discs in the back, which start to compress the nerves. As the nerves start to get squeezed down into a tighter space, they cause pain in the back that will radiate down the legs. The procedure is performed through the low back area of the person. It is done through an incision that is the midline over the bumps that are present over the lumbar spine. As you can see, there are areas where the bone protrudes through the back of the spine. If we look at the model, the front is shown here. These are the bones of the spine, and in between there are discs. In the model you can see there is a yellow structure that travels through the tunnel in the spine, which is the nerves that are contained in what we call dura. If I turn the spine, you can see that there's a circular tunnel that the nerves travel through. This area should be about the size of a quarter. In spinal stenosis, this space can get as narrow as the size of a pencil lead. In order to make this space bigger, we have to remove the roof of the spine in order to make more room. This is best shown in the lower levels of the spine. If we look here, you can see the nerves traveling through their tunnel. In order to make this space bigger, we have to remove the bumps that are present called spinous processes and a little bit of the edges here that are called lamina. And we would do this on both sides. This creates an opening so that we can reach in and open up the sides of the spine. In addition, when we do the surgery over this area, we just move the muscles off to the side. The muscles are not cut, they're just moved over so we can see these areas. Once we are finished, we can pull this area back, sew the muscle fascia up over the top, and then all the stitches are buried under the skin with no stitches to come out. Therefore, we've opened up the space for the nerves, but we've also restored the muscles back, and then we've closed the incision without need for stitches to come out. The surgery can take as little as less than an hour, or it may take several hours, depending on the work that needs to be done. Sometimes people can go home the next day, and other times people need to stay in the hospital for a few days until they recover. This depends on the patient's age, health, and the overall severity of their disease.